Good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Robert J. Havey, MD, Institute for Global Health, and the John Philip Fair Professor of Infectious Diseases here at Northwestern Feinberg School of Medicine, who answers your COVID questions every Tuesday and Thursday here on the Havey Institute for Global Health's Facebook page. And today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest COVID headlines through today, the 18th of November. And we invite you to continue to submit your questions to us via Facebook at NU Institute for Global Health or via email at globalhealthinstitute@northwestern.edu. And leading the discussion again today is Sophie Biskowski, who is our student research assistant with the Institute. So Sophie, I now turn it over to you.
Thank you, Kristen. Hi, Dr. Murphy.
Morning.
So in the United States, 59.1% of the population is fully vaccinated, but we are now seeing a pretty high rise in cases. Over the last 14 days, there's been an 18% increase in cases, and we are now seeing an average of above 80,000 cases. Yesterday in the United States, we saw 114,000 COVID cases, and there are more than 50% of the states that are seeing an increase of a large quantity, but now there are states that are seeing increases of 50, 60, and 70%, such as Minnesota, New Michigan, New Hampshire, Vermont, Rhode Island, Wisconsin, Indiana, Massachusetts, our very own Illinois, and Connecticut. In Illinois, we are seeing an increase of 58% over the last 14 days, with your average of 3,500, which, as I mentioned a couple of days ago, the average was at 2,100 less than 2 weeks ago. What can you tell us about what's going on in the United States? I mean, wow, this surge is happening before the holidays. So what can you tell us?
Well, it's not just the United States. There's many countries around the world, in Europe and elsewhere, that are having the same kind of phenomenon. The UK, Germany is up, Austria off the charts, Eastern Europe, and the United States. In the United States, it appears to be moving around. The South got it first. South and some of the Western states, they had their peak and now they're coming down. And now the peak is in the rest of the country. It's sort of moved, it's a wave. It just shows you how contagious this Delta variant is. It's still being driven by the unvaccinated. You know, you've got 59.1% in the United States fully vaccinated. So that means basically 40.9% are not fully vaccinated. So they're not, so half the country, you know, or not quite half, but, you know, 40% of the country not vaccinated. So they're the drivers of this, including the children who didn't qualify. But now many of the children 5 and up are qualifying, and they're lining up and getting their vaccines. We haven't seen any big problem with that. And you know, this is the way it's going to go. It looks like this is more, it's more like measles, where you have to have over 90% of the people vaccinated to stop measles outbreaks. Measles is a killer. The same thing is going to be true for COVID, just because it's so highly transmissible.
Definitely. And, you know, speaking of it being highly transmissible, one of the headlines is that the COVID winter surge is already here. What can you tell us about the pandemic not being over and this surge starting before Thanksgiving has even begun?
Yeah, the pandemic is nowhere near being over. It was wishful thinking back in June and July that we're not going to have this 5th wave and that everything is going to continue to go down. Well, we learn every day, and that didn't work out. And now we're bumping into the flu epidemic, the seasonal flu. We've already had cases reported. People have gotten flu. Last year was because before the vaccines came out last year in the winter, the mitigations were put in place nationwide were pretty strong. And what happened was those mitigations basically wiped out flu. I mean, it stopped. There's hardly any flu last year. It was really, really a phenomena that we could do that. This year's a little different. People are more relaxed about it. The vaccinated people are more relaxed, and then the unvaccinated people, they're just relaxed all the time anyway. So you know, that is just a combination to have another COVID spike, and we're going to get a flu spike on top of that. So if you get sick, now you need really you have to get diagnosed. But the diagnostic tests have improved. And it's very easy to differentiate between one and the other, and they're usually not together.
Yeah, definitely. And, speaking of the pandemic not being over, Minnesota has become the nation's COVID-19 hotspot. What can you tell us about what's going on with Minnesota and COVID?
Yeah, that was kind of a big surprise. The upper Midwest is doing so badly. And it's not just Minnesota, although Minnesota, I had read a report that 95% of their ICU beds were full. That's a crisis mode. That's like, wow, bells need to go off. Wisconsin's not doing well. Michigan is doing terrible, all over Michigan. And Illinois up 58%. We had been doing pretty well here in Illinois, but those days are over. We're going up. And just before the holidays. So, now people are going to be gathering, they're going to be traveling. This is going to continue to spread this. And we have to do whatever we can to protect ourselves. And we'll talk about that because many of the questions are about that. So we'll save it for that.
Definitely. And for the last headline, FDA is expected to authorize Pfizer booster for all adults this week. And as you mentioned earlier, maybe Moderna as well. What can you tell us about what's going on with boosters?
Yeah. So this whole communication and public health policy on booster shots. It was known months ago that immunity wanes. It decreases over time with these vaccines. It decreases over time even more quick with actually getting COVID. After you get COVID, the immunity goes off after 2 or 3 months, and you can get a second infection. But with the vaccines, it's really starts sometime after 6 months. So you want to do it before you see all the cases going in the hospital. And the Israelis, which have a very tightly controlled population, and everybody got the Pfizer vaccine, and it was a very high vaccination rate. They were the first ones to ring the bell that, hey, something's going on here. And they've been pushing this for months. And, they hemmed and hawed, and they've got these 2 advisory committees, one the FDA, one the CDC. Oh, they work together, but they don't. They change who should get it and whatever. This has got to stop. This is just very bad communication. Immunity wanes after 6 months, get a booster. There's plenty of supply. It's not a capacity issue. We are sending vaccines abroad. Matter of fact, one thing we didn't mention earlier is that the current administration has pledged to pump more money into the capacity of the Moderna and Pfizer vaccines for the United States for export and for use here. So, you got the 60% of the population that wants to do it, and they're going to keep up, and they're going to get their boosters, and they're going to continue to be protected. And that capacity for vaccines is going to increase now because of this push by the current administration. So, but they've got to restructure this approval process. Why we have to go through 2 different separate things? Ideally, there should be a pandemic crisis committee oversight, external from the government, and they can do everything. Why can't they just do everything together and act like good public health officials and just get this thing moving in a way that everybody understands and makes sense scientifically? You don't want to get COVID. You don't want to get COVID. It's not that you don't want to get hospitalized. You don't want to die from it, but you really don't want to get COVID. So we need to prevent people, help them prevent getting COVID. So that really needs to be the overriding philosophy and goal, and it can be done in a much more streamlined fashion than it's being done now without all this confusion. You know how many EUAs have come out about the vaccines? Who gets vaccinated? What, how sick, how old do you have to be? This, what time? It's just very confusing. It doesn't have to be that confusing. It could be much easier.
Yeah, definitely. And now for some COVID questions. So I noticed that many southern states, such as Florida, Texas, Alabama, have been removed from the travel advisories for unvaccinated Illinois residents. A while back, these states had the worst surges, but now seem to be trending lower than the rest of the country. That seems counterintuitive. Can you explain that outcome? Have they achieved herd immunity? Can you tell us a little bit what happened with the southern states and why all of a sudden the Midwest is spiking in cases?
Yeah. This is a really good question. Like, it just doesn't make intuitive sense. The South was so bad. How come they just got better and the North is so bad? And it has all to do with how these waves come. From the beginning, it was never a straight line going up. Never. It didn't even wobble. It went up, it went down. It went up, it went down. We're going into the 5th wave in the US. Some countries have only had 3 waves. Some have had 6 waves. It really depends on the epidemiology and the transmission to the high-risk people. So in the South, where, you know, vaccine rates are generally low, mitigations are often, there's laws against mitigation, you know, so they encourage people to get infected. You know, they got blasted first. So what happened? All the high-risk people, all the people that were getting exposed and whatever, they got COVID. So when those people got COVID, of course, they're protected for a couple months afterwards, the rate went down. Plus, there are people that are getting vaccinated. So they peaked and they're coming down. And in the North, now that everybody has gone indoors and everything, the rates are going up because people are not mitigating as much as they did before. People are tired of it and they enjoy their life, living, going out and whatever, but they're not being careful enough. And so now the Midwest is getting slammed. But it's still, unfortunately, being driven by the unvaccinated.
Yeah, it's very unfortunate. And for our second question, Dr. Murphy, I'm thinking of flying to South Florida to visit family in December. What are your thoughts on this? Is it safe? I'm fully vaccinated and have my booster.
Well, any immunocompromised person, I don't know if they should even travel, but let's assume this person is not. Right now in Florida, the rates are lower than in the upper Midwest. So maybe it's safer down in Florida right now or in Texas because they're on the downswing. However, their behavior down there with this anti-mitigation does put people always at risk. I mean, it makes me very uncomfortable being in a public place. I'm wearing a mask, but nobody else is wearing a mask, or very few people. And, you know, it's still, you can get infected down there. It's not gone. The pandemic is not gone from the South. It's just on the way down. So, you know, that's a personal decision. If you want to take the risks, you have to be careful, you know, wear a mask when you go out in public and avoid crowded indoor places.
Yeah, definitely. Now for our third question. Dr. Murphy, COVID test positivity rates in Illinois are hovering around 2%. Is it true that influenza test positivity rates are much higher during flu season because we don't test nearly as many people, only those with symptoms, and also because we probably don't test the same people numerous times? Typically, only around 50% of the population get the annual flu vaccine, yet there are no government-dictated masks or vaccine mandates related to the flu. Do you know why we treat COVID and influenza differently?
Yes, they're very different. COVID is much more deadly than influenza. And influenza behaves differently. It really affects younger people, young children in particular, and older people and immunocompromised people. The otherwise healthy people in the middle, you know, they get the flu, you know, there's a treatment for it. You can take Tamiflu if you get diagnosed appropriately, works very well. You know, so that's one thing. But the death rate from the mortality rate is much lower, like 5 times lower with influenza. And there are mandates. For instance, in the hospital system, everybody there has to be vaccinated for the flu. It has to be documented in their medical record and reported to the administration officials by November, I think it's November 1st. And if you're not vaccinated, then you can't come in the hospital. So there are mandates out there, and there's, you know, mandates for daycare centers and other facilities and the like. So there are some mandates there. Perhaps there should be more mandates about influenza. We certainly controlled it well last year, but I don't know if people want to be that draconian about it. But remember, it's a bad disease. It can kill people, but coronavirus is worse.
Yeah, definitely. For our fourth question, study results do point to a higher overall COVID mortality rate, although from what I have read, influenza and related pneumonia deaths are not documented, as well as COVID deaths are estimated. That being said, there's no denying that there have been more COVID-related deaths. My question to the doctor is why for all these years we have not protected our children with the same measures as we are doing now for COVID. Dr. Murphy, it's a question, so go ahead.
Yeah, it's kind of the same answer as the prior question, but the problem with COVID is it affects people. It can affect people of all ages, and the risk groups are defined pretty loosely. Like you go in the hospital now, approximately 80 to 85% of all the people with COVID in the hospital are unvaccinated, and not every one of them is at a severe high risk group. And so what's going on there? It turns out there are some genetic factors that make some people more at risk. That's being studied, and it looks like it's one of the explanations. But there's plenty of younger people in the hospital now that are very, very sick with COVID, and they're hospitalized, and most of them are unvaccinated.
Yeah, of course. And for the fifth question, Dr. Murphy, why shouldn't a person that is vaccinated go to dinner with a person that is unvaccinated?
This is a very practical question, and it's coming up all the time, especially with the holidays. I get probably about 5 of these questions per day. Family gathering for Thanksgiving. And there's always somebody who's unvaccinated in the family that's wants to come or has been invited or whatever. And then usually there's also an older person, a grandparent, or somebody who is at very high risk. Even if they're vaccinated, they're still at risk for ending up in the hospital or dying from this thing. So the difference is, even though you can get a breakthrough infection if you're vaccinated, the chances of getting infected are 5 times greater if you're unvaccinated. So for every unvaccinated person has 5 times the risk of basically getting COVID. And so they're just like a hotspot. And that is the driver. Now, certainly, a lot of people are going to do this and everything will be fine. And then some families, everyone in the family is going to get it from this unvaccinated person, and somebody's going to die. So it's all about lowering your risk. It's a personal decision. There's no rule or law or anything that prohibits it. But if you want to stay safe, you're not going to want to have unvaccinated people in a gathering like a Thanksgiving dinner. I mean, if you want to keep your risk really low, particularly to protect the elderly people and anybody who has an underlying high risk condition. So it's up to you. You're going to take that risk or not. It's basically, you're playing roulette, Russian roulette.
Yeah. And, following up to that question for the 6th question, if a person can get and transmit COVID, even though they are vaccinated, what difference does it make if someone at the holiday get together is not vaccinated?
Well, it's basically the same answer. The unvaccinated have 5 times more likely chance of getting infected. And so if they're that much more likely to get infected, they're just the hotspot in the crowd. And, family get-togethers, you're sitting at a table, can you stay 3 feet apart or 6 feet apart, whatever you're going to use? It's pretty much on a practical level not going to happen that way. So it's the safest thing is just to keep the unvaccinated people away.
Yeah. And those were all of our COVID questions for today. Thank you, Dr. Murphy.
Great. Thanks, Sophie.